We want to get an expert opinion on these developments. Joining me is Professor Teo Yik Ying, Dean of NUS's Saw Swee Hock School of Public Health. Welcome back to the show, Professor. Professor, changes to healthcare protocols, a simplified testing regime for VTL travellers, some of the announcements today. What do these illustrate about Singapore's management strategy currently?
Thank you very much for having me back. There are indeed some simplifications of the testing regime for the VTL travellers, but I would actually classify this to be rather minor changes rather than big changes that will really smoothen and facilitate hassle-free travel. Because after all, we still require VTL travellers to test themselves daily for the first 7 days after they enter Singapore, except that this no longer need to be supervised, nor do they need to submit the results. Also, should anyone test positive during this period, there is now a convergence to the same protocol as with anyone in Singapore who tests positive and has not been traveling. So basically, really looking at whether they are unwell or well, and to follow the respective protocols, 1 or 2, staying at home, monitoring their symptoms. So really, we are still very cautious and trying to pick up imported cases amongst VTL travelers as early as possible. But at least now we are more knowledgeable about the impact of the Omicron variant. We can now align our border control measures with our existing community protocols for anyone who have been testing positive. After all, as part of today's announcement, MOH did mention we will no longer differentiate between Omicron and non-Omicron infections. So if we look back at our heightened border measures that were introduced previously, those were specifically directed at trying to pick up Omicron and to minimize the impact of Omicron in the population. So now we can actually move to a protocol that is much more aligned with our general approaches to manage COVID-19.
Professor, you mentioned small changes. These tweaks, shall we say, are they enough to prevent a stricter tightening of COVID-19 rules further down the road?
Well, I actually did mention that these tweaks really fairly minor in nature, and I don't think it will really have an impact on the trajectory of our COVID-19 infections. What is clear is that Omicron is much more transmissible. So I do expect the number of infections in the community will increase steadily over the next few weeks with or without today's changes. But what we do, however, need to continue monitoring is whether this increase in infection numbers will similarly lead to a surge in the number of hospitalizations and exert an increased burden on our hospitals and healthcare workforce. Now, the situation in Europe and North America, as we have seen in the news daily, is really a mixed bag. But all the data concurred on the fact that Omicron can increase the number of infections, but does not necessarily increase the pressure on the healthcare system. So whether we need to tighten COVID-19 rules further down the road, I expect this will depend more on the hospital situation, like what we've always mentioned, rather than really the number of infections happening in the community. And when I mention the hospital situation, we do need to be very careful that the present protocols for manpower management, especially in our hospitals, do not incapacitate our healthcare workforce directly. For example, if we start to isolate and quarantine many of our nurses and doctors simply because of their proximity or interactions with known cases, we may end up with a situation like in many of the countries in Europe or North America, that Omicron indeed drives mostly asymptomatic and mild infections that do not require hospitalizations. But our hospital or healthcare workforce comes under pressure because many of the healthcare workers are quarantined away rather than allowed to go back to work. So that's something we need to be very careful of.
So, Professor, on that, what would you suggest then for us to almost, prevent or not take that route of isolating our healthcare manpower?
So this is really where we have to understand that as part of living with COVID-19, the data clearly suggests that even with Omicron infections, fully vaccinated people, the problems of COVID-19 now really resembles that of a common cold or a flu. And if that is the case, we never really keep our healthcare workers isolated or quarantined away for a fixed number of period when they have a cold or when they have flu. We do watch out for whether they need to stay away with medical leaves or not. But there is no official protocol that says that suddenly an entire group of healthcare workers are not allowed to go to work. Because many of these healthcare workers, either they stay together or they do interact amongst themselves on a daily basis. So if someone does test positive, there is a real chance that the health risk warnings will be sent to an entire cohort of healthcare workers in the same section or same department, that you can incapacitate the healthcare workforce simply because of the protocols, rather than a genuine surge in the number of people seeking help in the hospitals. So that's something that we need to watch.
Professor, separately, the Health Ministry's daily updates will no longer differentiate between Omicron and non-Omicron infections, like you mentioned earlier. Case numbers will also include supervised ART positive results. What do you make of this new way of reflecting Singapore's COVID-19 situation?
So, two changes there that you have mentioned. The first is really the fact that we no longer differentiate between Omicron and non-Omicron. Well, I think that is the right decision, because in a matter of a couple of weeks, I actually suspect that almost all the cases in Singapore will be Omicron infections. So trying to differentiate or between Omicron or non-Omicron, I don't really see that there is any need anymore. Now, the second change that you talk about is that case numbers that are reported daily will now include supervised ART positive results. And to be honest, I'm rather surprised by this move to now count these cases from the ART test, because this actually appears to signal a regression in our strategy towards having this return to focus on infection case numbers again, rather than on the situation in the hospital. So I think there's some mixed signals being sent here. It is actually important to clarify first that this supervised ART positive results that we talk about are mainly those people who test positive with ARTs in healthcare facilities. So people who are seeking care in a healthcare sector, they are tested with an ART test kit, and subsequently these people test positive. So I can only interpret this from the perspective that this is going to be temporarily useful to correlate the infection case numbers and with the situation in the hospitals, because these people are the ones that are already seeking care in the hospitals and are testing positive. Now, at some point, we do need to differentiate between those people who are seeking care in hospitals for reasons because of COVID-19 infection versus those that are in the hospitals for reasons that are completely unrelated to COVID-19. But because as part of the admission protocol, they may be tested with an ART kit for COVID-19, and therefore they are found to be positive. But they are actually not in the hospital for COVID-19. So we need to separate these two groups of people, because really the interpretation is completely different. Now, in the long term, I do think we need to have a consistent approach in our transition planning to endemic COVID, whether daily case numbers will indeed still be relevant or no longer relevant, and we will not focus on it anymore. So I hope counting this ART positive results in a healthcare facility, it's really just a temporary measure and not a signal to return to watching daily case numbers so closely that a number of our public policies are decided on the basis of our daily case numbers.
Professor, as always, thank you for your perspectives. Professor Teo Yik Ying from the Swee Hock School of Public Health at NUS.